Hi, I'm Dr. Sarah Hurvitz from the University of California, Los Angeles, and I am a breast medical oncologist. Breast cancer is not one disease. It is comprised of several different subtypes. In the 1980s, scientists identified that about 20% of breast cancers are characterized by a gene abnormality within the cancer cell, whereby there are too many copies of the gene for what's called HER2 or HER2. When there are too many copies of that gene in that cancer cell, it was shown that there's too much of the protein of HER2 or human epidermal growth factor receptor number 2 that is expressed on the cell surface. And when that happens, it causes that cancer cell to divide and grow and behave in a more aggressive fashion than cancers that don't have that HER2 alteration. This abnormality was shown in the 1980s to be associated with more aggressive disease biology. So those patients who were diagnosed with HER2 abnormal or HER2 positive breast cancer tended to have a higher risk of having lymph node metastases and a lower chance of being alive at 5 years than patients whose tumors did not have the HER2 abnormality. Now, that would have been a sad ending to the story had scientists not gone on to develop and discover therapies that can target or go after that HER2 overexpression on the cancer cells. First, a therapy named trastuzumab, which is also known as Herceptin, was developed. And this is essentially a protein that targets the HER2 on the HER2 overexpressing cancer cells. It's given intravenously as an infusion, and it goes throughout the body and finds any cancer cells that have too much HER2 on them and binds to that HER2, and in some way tells the cancer cell that has HER2 overexpression that it should die. It turns on that cell growth and division and allows the cell to undergo natural programmed cell death, what we call apoptosis. So now patients who have HER2 positive breast cancer can expect to have a survival that's as good as or even better than patients with HER2 normal disease, meaning that HER2 targeted therapies have really altered the natural history of this disease. It used to be 30 years ago, we'd tell a patient with HER2 positive breast cancer of any stage that your disease has a worse prognosis compared to other types. Now we can tell patients your disease, as long as it's treated appropriately, has as good a prognosis as HER2 negative disease.